And my favorite part of my role specifically is not just helping patients, but helping our pharmacists and helping them be successful and developing them and helping them maximize their potential in their career. My name is JR Yates. I'm a pharmacist, and I'm the Assistant Director of Inpatient Pharmacy Clinical Services at the University of Tennessee Medical Center in Knoxville, Tennessee. Broadly speaking, I oversee the clinical services of our pharmacists and their clinical work here in the hospital, making sure that medications are used as safely and effectively as possible. Day to day, I actually have 2 typical days, I would say. So a couple days a week, what we call being on service. So I'm working as a pharmacist on one of our decentralized pharmacy teams, where we round with the physicians, we verify medication orders, review medications for safety and efficacy. And then on the other days of the week, I do more of my administrative role. So meetings, projects, scheduling of our pharmacists, doing some research, all kinds of things to make sure that medication use is optimized here in the hospital. So we have a lot of pharmacists here at the hospital, a lot of which are specialized in certain areas. So we have pharmacists split up onto the different patient care floors. They spend a lot of time on the floors, working directly with physicians and nurses to help take care of patients. We've got pharmacists that work in critical care and oncology, internal medicine, cardiology, pretty much any of the specialty areas that we have here at the hospital. We do have pharmacists kind of embedded into those teams. I think to do my job successfully, a couple of the skills would be communication is really important. So I interact with a lot of different people. I wear a lot of different hats. And so being able to talk to and communicate with different types of healthcare providers, whether that's other pharmacists or physicians, nurses, being able to talk to patients effectively and counsel them, and a variety of other team members here at the hospital as well. So my journey, I've been here at UT Medical Center for several years, ever since I was in pharmacy school. So I completed my last 2 years of school here at the medical center and did several rotations here in my last year of school. Through that process, I decided I wanted to stay for some residency training. So I did a PGY1 residency here at the medical center, followed by a PGY2 specializing in internal medicine, and was lucky enough to be able to be hired full-time after that. And so I progressed through a variety of different roles since then. I started as an internal medicine specialist, working with our medicine teams at the hospital. About 3 years ago, I stepped into a supervisory role, so starting to get into more of the administrative aspects. And then earlier this year, I stepped into my role as Assistant Director of Pharmacy. One of the other big things I've been involved with is training of pharmacy residents here. And so I spent 4 years as the PGY1 Residency Program Director, and now I'm serving as the PGY2 Internal Medicine Program Director. And that's been really rewarding, just being able to kind of give back and help prepare the next generation of pharmacists. My favorite part of being involved with residency training is just seeing the growth that happens in the relatively short time that they're here with us. A year or 2 out of your career is really not that long when you look at the span of your whole career, but seeing the growth that happens when they come in and they've just graduated from school and they're nervous, they've never acted truly as a pharmacist before, to the end of their training where they're just totally confident and ready to go out and work in a variety of practice settings, and being able to kind of have an upfront view of that and help in a lot of ways to facilitate that development has been really rewarding. It's one of my favorite parts of my job. I think the health system area just kind of piqued my interest because the patients are very sick, to the point of being hospitalized, and that brings a lot of challenges in terms of what medications should be used, how to dose the medications, drug interactions, adverse effects, all kinds of different things. And so to me, it was just the challenge of the patient, and I felt like I was able to use the training that I had and the skills that I had to really make a difference in the patient's life and help their care to get them better. I think my favorite part of being a pharmacist is being able to help patients and truly feel like I make a difference in their care. And my favorite part of my role specifically is not just helping patients, but helping our pharmacists and helping them be successful and developing them and helping them maximize their potential in their career, and just have it be as a rewarding of a career as I've had. I think to be a good leader, you've got to have the mindset of being kind of a servant and not putting people in a position to do something that you wouldn't be willing to do yourself, and having the knowledge and expertise that it takes to kind of lead that group of people, but also being compassionate, being a good listener, and being able to just maximize their potential and set them up for success. We are more.